So hello and welcome you all to sailtomdsacademy Dental Academy. I am Dr. Malay Trivedi, Professor in College of Dental Sciences and Director of the Academy. So dear students, we have prepared a video already. The link is there in description box, as well as you will click on I button above. How to prepare for the government dental examination, how to prepare for your GPSC examination, for your MPPSC examination. We have divided a very small thing, like how you have to divide your subject, topics, everything in detail I have discussed in that video. So please, after viewing this video, go through that video also. Okay dear students, so now why I am making this video? From last 10 to 12 days, many students are asking me few questions, few doubts are seeded in their mind. सबके मन में थोड़े से डाउट्स है जो उनको प्रिपरेशन में थोड़े से हर्डल क्रिएट कर रहे हैं. सो दैट्स व्हाई आई एम प्रिपेयरिंग दिस वीडियो. आई एम गोइंग टू डिस्कस द कॉमनेस्ट डाउट the students are having during their preparation. If at all somebody have more doubt, anything like that, you can let me know in the comment box, or you can message me. My number is there at the end of the video and also in the description box. So without wasting time, let's start with the video. So first of all, dear students, you have to be self-disciplined. Okay, if at all you aim for this examination, for this very beautiful opportune examination, you have to be disciplined. You have to study properly. It is not like that, okay, हुआ तो ओके, नहीं हुआ तो नहीं, फॉर्म भर देंगे, सब भर रहे हैं हम लोग, भर देंगे नहीं. यू हैव टू बी सेल्फ डिसिप्लिन इफ एट ऑल यू वांट टू क्लियर. It is not like that if you are studying and you are not getting. No, if you study with proper discipline, definitely you are going to get through these exams. Now let's start with the video. Doubt 1. बहुत सारे स्टूडेंट पूछ रहे हैं मुझे टाइम के रिलेटेड डाउट कि सर हमारे पास बहुत कम टाइम बचा है. नो डियर स्टूडेंट्स, यू हैव लॉट ऑफ टाइम. The exam is in the month of October, November. Today is February. We are in February. So आपके पास around 7 to 8 months है, which is ample time for the preparation. Previously, if you take out GPSC conducted in last 5 years, they used to give hardly 3 to 4 months. But now you have double the time for your preparation. Okay. So if you also ask me, sir, last 2-3 महीने पढ़े तो चला गया, नहीं चलेगा dear students. Why? Because competition is there. Remember, students who have just completed their BDS, they are giving. Students who are doing the MDS, they will give. Who have completed the MDS, they are going to give. Students who are practicing, also they are going to give. And not only students from Gujarat, the students outside the Gujarat, and many inquiries are coming to me, they are also planning for this examination because the place Gujarat is good. Okay, you can, and the salary also good, so people are planning. Even the same hold for the Madhya Pradesh examination also. So you cannot consider this exam as a very simple exam. It is a bit competitive. So you have to start early, as much as early you have to start. You cannot take, okay, बाद में पढ़ूंगा हो जाएगा. No, strategically you have to start. Okay dear students, let's go for the second thing. Now few of students have messaged me, sir, क्यों इतना पढ़ना है, डायरेक्टली हम लोग पल्स या गौरी शंकर पढ़ लेंगे, सिर्फ MCQ पढ़ लेंगे तो बहुत हो जाएगा. Now dear students, let's say आज आपने 100 MCQ पढ़े without having complete knowledge of that subject. Let us take the example like red and white lesion. Okay, red and white lesion आपने पढ़ लिया, ल्यूकोप्लिक किया, एथोप्लिक किया, उसके आप MCQ पढ़ रहे हो, आपको उसका पूरा टॉपिक या मेजर कोर ऑफ द टॉपिक आपको याद नहीं है, तो आप लोग क्या करोगे? आपने क्वेश्चन देखा और फर्स्ट थिंग व्हाट यू विल ट्राई टू प्ले गेस गेम, एंड हियर द स्टूडेंट्स आर मेकिंग मेनी मिस्टेक. लेट्स से आपने एक क्वेश्चन पढ़ा, उसको आपको कॉन्फिडेंट नहीं हो कि उसका आंसर क्या है और आपने गेस किया, देन यू सी द ओके एक्सप्लेनेशन, ओके माय आंसर इज रॉन्ग और मे बी योर आंसर इज राइट. बट व्हाट विल हैपन, द ड्यूअल नेचर, द ड्यूअल आंसर विल बी क्रिएटेड इन योर माइंड. सो जब एग्जाम में वो क्वेश्चन या वैसा क्वेश्चन आया, तब आपके माइंड में वहाँ पे 2 क्वेश्चन आएंगे और आपके पास हार्डली 45 सेकंड्स to 1 मिनट होगा वो आंसर देने के लिए. और इस चक्कर में मैनी स्टूडेंट्स आर गेटिंग रॉन्ग फॉर द MCQ. यू नो, सब बोलते हैं मैंने गेस किया, 10 में से 2 ही गेस सच्चे पड़े बिकॉज ऑफ दिस थिंग. सो विदाउट हैविंग द लिटिल बिट कंसेप्ट और लिटिल बिट नॉलेज ऑफ द कंसेप्ट, डोंट डायरेक्टली अटेम्प्ट द MCQ. दिस इज द बिगेस्ट मिस्टेक यू आर डूइंग फॉर योर प्रिपरेशन. एज वेल एज आपको पता नहीं होगा तो आप लोग को बोर फील होगा. यू हैव टू कीप ऑन रिलेटिंग द थिंग. Let's say you are doing root canal therapy, you cannot directly do obturation. You have to go for the step, you have to go for the exercise, you have to go for the Q mechanical preparation, and then you can go for the obturation. The same way, while reading the MCQs or preparing for the competitive examination, you have to read little bit theory also, and then you can go for the MCQ. I'm going to discuss in later slide how you have to approach the things. And remember, MCQ are not going to repeat. पल्स के MCQ नहीं आने वाले. There are chances. Let's say 200 questions are there. The chances of repetition will be there 25 to 30%. Days are gone जहाँ पे पूरा वो लोग papers repeat करते थे. So don't depend on just repetition. Okay, dear students. So try to relate and don't play guesswork. So how you have to start studying? मैंने बोला कि directly MCQ नहीं पढ़ना. क्यों? This is my method of teaching to my students. You can see the broad part of the pyramid method. That's a reading synopsis or notes. We have in our academy micro lectures are there. Micro lectures mean what, dear students? We have divided topic wise lecture, like 3 minutes, 5 minutes, 7 minutes topic wise lecture I have made. So you can click the topic and you can read. So you can either read our lectures, you can read either our notes or at least synopsis of the pulse. And then you have to go for the MCQ reading. Try this method. You will see the improvement, and as well as the revision is also needed. Okay, क्योंकि तुमको 7 महीने में 21 subjects complete करने हैं. Okay, it is not like that you can give 1 month, 2 months for a particular subject. So you have to study properly. Okay, dear students. Now, this is the big question. Sir, कितना पढ़ना है? Sir, इतना सही पढ़ना है? या बहुत पढ़ना पड़ेगा? या टेक्स्ट भी पढ़ना पड़ेगा? No, dear students. You have to work smart, not hard. आपको 21 सब्जेक्ट 4 से 5 महीने में कंप्लीट करने हैं और उसका रिवीजन भी करना है. So you cannot give one month for the subject. That's why I created micro lectures in my academy. So the needed thing you read, the important thing you have to read. Let's say you are studying, for example, ameloblastoma. It is not nice you should know the first to last part of the ameloblastoma. You should know the core important points. Okay, so that will help you to retain and to work smart. Because आपको सब कुछ याद नहीं रहने वाला. Okay, आप जितना पढ़ोगे उसका 50 to 60% रिटेन कर पाओगे. Okay, dear students, so more you read, more you are going to get success. That is the biggest wrong thing. You have to study smart. Properly you have to study, dear students. That is your synopsis, notes or lecture going through. Then you have to go for the MCQ and then comes the revision, dear students. आज आपने let's say 7 महीने में से 5 महीने में सब सब्जेक्ट कंप्लीट कर दिए. Okay, you have completed 21 subjects. आपको completely 21 subjects का सब कुछ याद नहीं रहेगा. You will retain 20 to 30%. बट यू रिक्वायर रिविजन आफ्टर दैट. जो आपने पढ़ा है उसको रिवाइज करना है. इफ आपने इतना पढ़ा कि आप रिवाइज नहीं कर सकते तो वो जो आपने सब पढ़ा है दैट इज गोइंग टू वेस्ट. यू विल बी ब्लैंक आफ्टर 5 to 6 months कि सर मैंने ये भी बुक पढ़ा, ये भी MCQ बुक पढ़ा, इतना पढ़ा पर मुझे कुछ याद ही नहीं रह रहा. वाई? बिकॉज यू हैव नॉट डन द रिविजन. दैट्स वाई रिविजन इज मस्ट. आई फॉलो 2 strategy ऑफ रिविजन, डियर स्टूडेंट. लेट्स से आज आपने 2 घंटा पढ़ा. लेट्स से आज आपने कौन सा कैविटी प्रिपरेशन और डेंटल सीमेंट का चैप्टर पढ़ा. सो बिफोर यू स्लीप आई ऑलवेज टेल माई स्टूडेंट्स आज ही रिवाइज कर लो. दैट इज अ रिविजन टाइप 1, अ सेम डे प्रिपरेशन. एंड सेकंड, डियर स्टूडेंट्स, यू हैव टू रिवाइज ओके आफ्टर अ पीरियड ऑफ 3 to 4 months. सो व्हाट हैपन? द मोर यू आर गोइंग टू रिटेन. बट विदाउट रिविजन द थिंग्स आर नॉट गोइंग गुड फॉर एग्जामिनेशन. आप सब पढ़ लोगे but उतना आप you will not able to express in the papers. That's why the revision is must for the preparation. Now general knowledge, big worry for students. Students are asking me, sir, general knowledge कैसे करेंगे? Dear students, first do the dentistry properly. General knowledge, is a bigger thing than the dentistry. Constitution है, cultures है, politics है, sports है, इतना कि आप dentistry complete ही नहीं कर पाओगे. So best thing is you can focus on dentistry. And I'm not saying don't study GK, but out of your 100% time, 70 to 80% time should be focused on the dentistry. You can score maximum in dentistry. And 20% time, let's say in a day, half an hour, 1 hour, or in a week, 2 to 3 hours, you can give for the GK. That's why what I do, dear students, in my academy, we have provided the PDF of GK, like constitution, maths, politics, sports, the science related question, all the different topics. I have provided the PDF and important MCQs. So read that much, more than enough. Current affairs. Don't start reading current affairs from now. You have to read the current affairs of 3 to 4 months before examination. So don't waste time. Otherwise, utilize the same time for your dentistry preparation. Okay, so you have to keep a balance between your dentistry preparation and GK. But remember, 80% is for dentistry and 20% is for GK. So now, dear students, those who are worried कि सर GK कैसे करेंगे? Few students are telling me, सर हम dentistry के लिए पढ़ेंगे और GK के लिए हम लोग कोई GPSC जो normal class on IPS IS level that also will join. This is the biggest problem you are doing. You will be in the, big doubt area. Okay, sir, वो भी करे, ये भी करे. So better study dentistry properly in proper detail, and for GK give a little bit time. Okay, we have good PDF. Anybody want, we can provide to them also. Now past papers. Sir, last years के past papers कर लिए तो चलेगा? Past papers पढ़ने हैं. It is very very important dear student. आपको past paper सारे पढ़ने हैं. ओके, उसमें से डेफिनेटली 10 to 20% आने वाला है, बट यू कैन नॉट डिपेंड जस्ट ऑन द पास्ट पेपर्स. यू हैव टू गो थ्रू द कंसेप्ट्स ऑल्सो. Okay, you can check. We have a plethora of past papers. We have more than 20 past papers of the GPSC examination, of the MPPSC examination recently conducted. So what happened when you see, you will think, okay, ये आंसर मुझे आ सकता है, but I'm not sure. So if your concept is proper, then definitely you can, with surety, you can give the examination. And one more thing also, dear students, remember your GPSC MCQ examination, your MPPSC MCQ examination is altogether different than your interview preparation. Interview is different ball game. That is separate preparation for the interview. Interview, they are going to not only check your dental knowledge, they are going to check your non-dental knowledge also, your personality, how you talk. That's a different thing only. So right now, just focus on the exam which is going to come. Don't focus on the interview. Focus on the present MCQ examination. Okay, dear students, so that's our course features. If somebody planning to join, the information is there on the screen. GK notes will be provided. The validity of exam, validity will be there till the examination. Plus, few students asking me, sir, हम लोग तो lectures attend नहीं कर सकते, हमारा clinic है, हमारे ये है, वो है. Dear student, that's why we have kept the micro lectures pre-recorded. You download our app, you click, and you can view the lecture. So at your flexible time, dear student, you can view the lecture. Because I can understand your feelings. Somebody at the clinic, some good patient has come to your clinic, some good work is there with you. You cannot leave that work and you can focus purely on the lectures. So we have done in such a way that based on the student will and wish, they can give the exams, they can go through the lectures. Okay, dear students, and even notes are also there, that will be helpful to you. If anybody want more detail, you can contact me on the number given on the screen. So that was all from my side, dear students. Any problem, any doubt, let me know regarding any of the examination. Till then, dear students, take care, work hard.